So, hi, can you tell me your name and what you do for Mercy Ships?
My name's Peter Linz. I'm a cardiologist. I'm the International Chief Medical Officer for Mercy Ships.
Can you tell me what kind of conditions the physicians and the medical staff that is coming to Africa to work with Mercy Ships, what kind of conditions they work in?
Obviously, they work on the ship, which is a fairly modern medical facility. However, you are working in sort of a resource constrained environment. What do I mean by that? Is you're working with equipment you may not be used to, and you only have a finite amount of it. But then, obviously, the conditions in terms of the patients and the kind of patients is very different in the sense that because of the poverty, there's this huge unmet medical need. So the problem for the physicians really is there are many, many more patients that they might like to treat than they can treat. So you're really in a triage situation of trying to figure out which patients do we say yes to, which patients do we say no to, what's the right kind of procedures to perform. And unfortunately, there's many patients we have to say no to, even if we could theoretically help them if we were just there longer, or maybe if we worked a little longer. And that's the other problem is when the need is greater than what you can do, there's always this internal drive. Well, maybe if I just did a little bit more, you can help one more patient. But obviously, there's limits to that. And then there's also the matter of trying to find the right level of sort of risk reward. What patients are really too sick or there's too much risk to do the procedure. On the other hand, there are patients where it's very, very low risk, but we don't have a lot of impact. So it's trying to find the right balance. And then clearly saying no to patients is difficult.